السلام عليكم.
وعليكم السلام دكتور، يعطيك العافيه.
السلام. يا هلا يا هلا، إن شاء الله كلكم بخير. الشاشة واضحة؟
واضحة دكتور.
السلام عليكم.
وعليكم السلام دكتور.
I'm happy to be with you again in your last system this year, HLS, and today we will have a small group discussion about iron deficiency anemia. The theme of this discussion will be to present for you a case scenario in a clinical contest, and then we are going to answer the questions. The small group discussion, as you know from your previous systems, it is a mixture between the basic sciences and the clinical aspects of the case. So I would like, first of all, to present the case for you, and then we are going to answer the question. I don't have many slides for you because it is a discussion, not a lecture. So we are going to answer it in a sort of a question and answer. And the most important parts, figures or say numbers, I will present them to you in slides. So who is going to volunteer for us to read the scenario? Anyone? One of you should read the scenario. يلا شباب. مين معاي من الطلاب؟ حمزة معانا؟ حمزة ماهر؟
معك دكتور.
يلا عيني اقرأ.
Mary is a 17-year-old student who has immigrated to Australia from Malta with her parents. She comes to you complaining of general fatigue and occasional dizziness.
occasional يعني احيانا. شوية صوتك ده يقطع حمزة، تقدر شوية تغير مكانك؟
صار بجوز النت عندي أول شيء.
يلا كمل.
Maria has no significant past medical history and is not on any regular medicine. She doesn't drink alcohol or smoke. Her parents and both healthy. On examination, she has strong peripheral pulses and her cardiovascular system examination is normal. Blood pressure is 115 على 5 over 75.
Yes.
Pulse
millimeter mercury.
millimeter mercury.
تمام.
Pulse is 90 per minute and
BMI body mass index
body mass index
19.5 kilogram per square meter. A normal range from 18.5 up to 25. It is lower normal. هذا يدل على أنه الشخص قديش بنية جسمه، نحيف، اعتيادي، overweight, obese, and so on. If it is more than 30, it is an obese person. In the case obese. If it is more than 25, it is obese, overweight. More than 25, overweight. More than 30, obese. Okay, Hamza, كمل.
Maria has pale skin, conjunctive and nail beds.
Conjunctiva and nail beds.
Conjunctiva and nail beds, given her clinical symptoms, age, and the findings on physical examination, you suspect that Maria may have iron deficiency anemia.
Excellent. Who is going to read for us the questions? Anybody? Muhammad al-Barakat. معانا.
One to
Okay.
assist you in establishing a diagnosis of iron deficiency anemia. What additional questions would you ask Maria? 2, would you recommend any investigations to assist you in confirming Maria's iron deficiency anemia? What is the most reliable marker of early iron deficiency? Third question, describe the structure of molecule of hemoglobin and explain the role played by iron in the transport of oxygen. Fourth, how is iron stored and transported in the body? Fifth question, what is iron deficiency anemia and how frequently does it occur? Sixth, what are the most common causes of IDA, iron deficiency anemia? Seventh, why are women more prone to IDA than men? 8, would you recommend drug therapy for Maria? Give details.
Thank you. Excellent. Now let us, first question, to make summary of what we have seen in the case scenario. So we have 17-year-old student, female, young female, immigrant, migrated to Australia from Malta, that is to say from the Middle East. So here I am thinking about some of the Middle East hemoglobinopathy. Yes, like sickle cell anemia, for example, thalassemia. So that is why young and immigrant. The most important symptoms that we have heard in the case scenario, fatigue and dizziness. No significant past medical history. She doesn't drink. This is Western literature, and she doesn't smoke. Her parents are healthy. So there is no hereditary thing, no hereditary background for transmitted diseases. On examination, she has strong peripheral pulses. It means that the hemodynamic is fast and her cardiovascular system is normal. Blood pressure normal, pulse normal, BMI normal, body mass index, but she has pale skin, pale conjunctiva, and nail beds. Also, the nails are pale. When you press them, you will not find that the blood will return rapidly to them. Given her clinical symptoms, age, and finding on examination, you have suspected iron deficiency anemia. Suspected, I am saying. There are no more information to go into details. So the first question, what other questions you would like to ask Maria? Anybody could answer the question? In order to help, because the history is not that comprehensive or complete. What other questions?
ممكن أسأل عن أنواع الأكل اللي بتاكلها أو الأنواع الأكل اللي ما بتاكلها؟
Yes. We can ask her about her diet. She is young, 17 years old. Some of them making dieting. Yes. And also we can ask her about her menstruation. Because sometimes there are other causes which might also contribute to iron deficiency anemia. We will come back to them during our discussion. Family history. Family history is negative here. Gastrointestinal problems. like celiac disease or blood loss, bleeding. Also, for a female at this age, she may be pregnant, although we don't have information in the history. Hemorrhoids, recent donation of blood, sometimes depression, psychological element, she doesn't eat well. The other question, what other investigations to confirm the diagnosis? First of all, the most important thing to mention.
نعمل دكتور complete blood count.
نعم.
نعمل complete blood count ونشوف مثلا نسبة الفيرتين والترانسفيرين بالدم.
Full blood count is very important investigation and basic investigation. We are going to see the morphology of the different cells. We are going to see the hemoglobin, the size of RBC, number of RBC, etc. So with these parameters, we can judge. Also, we can do, anybody could answer what we can do further?
شوف مستويات الترانسفيرين والفيرتين بالدم أو بالبدي.
Okay, we can do iron study. How much iron we got in the body. And we are going to go into details of this point. Other investigations, we can check serum ferritin. The serum ferritin is proportional to the iron present in the body. وراح نشوف why. Also we can check for B12 and folate. It's not necessary this anemia is iron deficiency anemia. Could be macrocytic anemia. And you know what's macrocytic anemia, which may result from B12 folate deficiency. Also, we can check for a transferrin saturation, substance called in the body a transferrin, and there is a test called a transferrin saturation. Transferrin saturation equal to serum iron divided by total iron binding capacity. I repeat it again, serum iron divided by total iron binding capacity, TIBC. Also, we can check for occult blood. What is occult blood? If you have upper GI bleeding, the RBC will be destroyed during passage through the gastrointestinal tract, and we can check occult blood in the stool. There is chemical test by which we can see whether the patient has got occult blood, يعني دم مختفي. الRBC مكسرة بس آثارها موجودة. Also, we can screen for celiac disease. Celiac disease is an important cause of iron deficiency anemia. The other question, what is the most reliable test or marker for iron deficiency anemia? ferritin level. وراح أحكي على الفريتين بعد شوي. And also the transferrin saturation. Transferrin saturation, as I said, is serum iron divided by the total iron binding capacity. So these are the tests that I have spoken about. Full blood count, iron study, total iron binding capacity, ferritin, B12, folate, occult blood, and screening for celiac disease. The most reliable, ferritin level and the transferrin saturation. So what is the transferrin saturation? Is the equation equal to serum iron over total iron binding capacity multiplied by 100. Transferrin saturation, T-sat. The normal value, you can see it here, in males 15 to 50%, in female 12 to 45. Total iron binding capacity. What is total iron binding capacity? It measures the body capacity to bind iron with the transferrin. And total iron binding capacity, 240 up to 450. How much we have got of iron that can bind to transferrin? The transferrin is not saturated fully, about 50% maximum. This is the total iron binding capacity. Now let us give you sort of background on what happened. There is another marker called serum soluble transferrin receptor, increase in iron deficiency anemia, increase in hemolytic anemia, normal in anemia of chronic diseases. This is versus increase in the serum ferritin. I will explain this to you. Remember that the iron, once absorbed from the intestine, it will be carried to the body by a substance called transferrin الذي يحمل الأيرون. transferrin يحمل الأيرون. It's a carrier of iron. This is the transferrin, you can see it, TR. Each molecule can carry 2 ferrous molecules. كل وحدة ترانسفيرين تحمل 2 ايرون. It will take, the transferrin will take the iron and distribute it to the body cells. The transferrin is usually synthesized commonly by the liver, so it is available in the body, the transferrin. The transferrin is a carrier of iron. It will take the iron and goes to body cells. In the body cell, there is a transferrin receptor. The green one here is the transferrin receptor. It is dimer, homodimer, linked by disulfide bond. This is the disulfide bond, 2 sulfur. It is called disulfide bond. So the transferrin will bind to this receptor. Now I have 2 iron molecules plus a transferrin plus the receptors. All of these, the iron, the transferrin, and the receptor, will be internalized inside the cell. تدخل داخل الخلية. ينتهي عمل الترانسفيرين. It will release the iron from it. The iron will bind to protein present in the cells, again mainly synthesized by the liver and most of the body cells in less amount. Is called ferritin. Ferritin is a protein present inside the cell, so it will store the iron that is brought by the transferrin. مين يخزن الحديد بالجسم؟ الفرتين. And that is why if you measure the ferritin, you will have an idea about the iron. The higher the ferritin is the higher iron. The lower ferritin, the lower iron storage. Clear? Ferritin, by the way, it is an acute phase protein, like the CRP, for example. You know, CRP, if you have inflammation or infection, it will increase. The same thing happened with the ferritin. If you have inflammation or infection, ferritin will be increased. For example, if a patient have a chronic disease like a tuberculosis, the ferritin will be increased. And if it is increased, you think that the iron is normal, in spite that the patient has got low iron level. يعني انت من ده تقيس الفريتين in infection or chronic inflammation, the ferritin will be high because it is an acute phase protein. It will give you false impression that the iron is also high. So sometimes we have difficulty in differentiation between iron deficiency anemia and anemia of chronic diseases, or sometimes called anemia of inflammation. Both are correct, of chronic diseases or of inflammation. In this case, we have to differentiate between the two categories. The best test that we should do is the soluble transferrin receptor. This receptor, part of it will break and release to the serum. If you measure the broken transferrin receptor, which is called soluble transferrin receptor, it is the answer for the differentiation between iron deficiency anemia and anemia of chronic diseases. And we will see that in this table. Anemia of chronic diseases, iron deficiency anemia. The third one, leave it. غير مطلوب من عندكم. Regarding the iron, in both conditions, low, reduced. Regarding the transferrin in anemia of chronic diseases, normal. Everything regarded a transferrin will be normal in anemia of chronic diseases, while the transferrin is increased in iron deficiency anemia. Why? Because the body is in need of iron. In order to increase the carrier of the iron, you have to increase the transferrin. انت بدك ايرون اكثر، لابد ان تكون الترانسفيرين اكثر. تمام؟ معادله بسيطه. فاذا الترانسفيرين will be increased in iron deficiency anemia. The transferrin saturation, which I said the serum iron over the total iron binding capacity, in both conditions are reduced. Total iron binding capacity is reduced in both conditions. Ferritin, in case of chronic diseases, will be increased, acute phase protein, while the ferritin in iron deficiency anemia is reduced. Why reduced? Because it is proportional to the iron. يعني زيادة الفريتين بالأنيميا of chronic diseases due to the infection or due to the chronic inflammation. كيف نميز بيناتهم؟ Soluble transferrin receptor. We can measure it in the blood. It is normal in case of anemia of chronic diseases, while it is increased in case of iron deficiency anemia. This table is very important. It is the core of this lecture. Now let us ask the other question. As I said, we can do further investigations which I have mentioned, just to see the differential diagnosis. Iron deficiency anemia, by the way, is hypochromic, described as hypochromic microcytic. This profile, hypochromic microcytic, could be seen in other diseases. Tamam? Who can tell me what other diseases can give hypochromic microcytic?
Thalassemia.
Thalassemia, excellent. Anemia of chronic inflammation. هسه اللي حكيت عليها. And what else? Anybody knows? Sideroplastic anemia. Sideroplastic anemia, in which there is a ring around the RBC which prevent it from taking the iron. It's called sideroblastic anemia. أكيد أخذتوها بمحاضراتكم. تمام؟ فإذا we have to differentiate between the different causes of hypochromic microcytic anemia, and iron deficiency anemia is the most common cause for these abnormalities in the RBC. The most reliable marker, as I said, is ferritin. ferritin عالي عندك، الأمور كويسة، معناتها الأيرون عالي. الفريتين لو، معناتها الأيرون لو. الإكسبشن الوحيد إلها شو عندك؟ anemia of chronic diseases. الفريتين راح يكون increased. الأنيميا تعطي لك فولس هذا البروفايل من يكون الفريتين عالي، مو عالي نتيجة الأيرون، عالي نتيجة الانفلاميشن، كون أنه الفريتين هو acute phase protein. واضحة هاي النقطة شباب؟ There are practical points about the causes of iron deficiency anemia. I said I will come back to them. It depends on the physiological demand. Growing children, they require more iron. Pregnant women require more iron. So of course they may suffer from iron deficiency. Loss of blood through menstruation. Postmenopausal women. Also, if there is difficulty in absorption of iron, that is to say, malabsorption of iron, may be caused by impaired gastric acid secretion. If a patient is using a proton pump inhibitor, like lansoprazole, omeprazole, or if he has got intestinal pathology like celiac disease. Most commonly in the community, inadequate dieting, especially in young females who are following strict diet, may suffer from iron deficiency anemia. The vegetarians الذين يأكلون النباتات فقط, and as I said, also an increased demand during a pregnancy. The patient usually, what are the common signs and symptoms? The patient will suffer from fatigue, weakness, shortness of breath, headache, dizziness, lightheadedness, cold hands, cold feet, sore tongue. The tongue is sore and the nails are brittles. brittles يعني تتكسر بسهولة. arrhythmia, اختلاف بنبضات القلب. Usually the patients suffer, especially children, what we call it graving Okay? What we call it graving. What is graving? graving يعني المريض أو الطفل بحب ياكل مثلا التراب. هذه علامة من علامات الايرون ديفيشنسي انيميا. علامة من علامات الايرون ديفيشنسي انيميا. It is called PIKA. PIKA. يعني الطفل من ياكل التراب is called PIKA. Graving. Sometimes can eat starch. النشا. Ice, dirt. So this is PIKA. Now, also, as I said in the beginning, we can ask about family history. We can ask about bleedings in the stool, in the urine, whether the patient has got gastric ulcer that bleed, or a duodenal ulcer, or uterine fibroid, قطع هيك, fibroid called in the uterus, colon polyps, cancer, colorectal cancer, or whether the patient has donated blood frequently in the last few months. Sometimes certain drugs can cause bleeding from the intestine, like NSAIDs or proton pump inhibitor that prevent the absorption of iron. These are the most important things that I have mentioned. What sort of diseases that could result, or what are the symptoms that could result from supplying iron? If the patient has got mild anemia, giving iron orally is adequate, which can be given up to 3 months. We may extend it up to 6 months. 1 tablet a day of ferrous iron. If it is more severe, you can give 2 tablets. Giving iron sometimes can result in abdominal pain in some people, not all. Nausea, vomiting, constipation or diarrhea. A black coloration, discoloration of the stool. يجي لك المريض يقول لك دكتور, I have got a black stool. In this case, you have to start with small doses of iron and increase it gradually. And the patient can take certain substances that could enhance the absorption of iron from the body, like vitamin C. Also should stop using other substances that may inhibit the absorption of iron, like a proton pump inhibitor. Tannin, which is present in tea. يعني لا ينصح المريض بشرب الشاي بعد الايرون. There should be some time before he can drink tea. Also calcium preparations also can inhibit iron absorption. Sometimes antacid can inhibit iron absorption. Thyroid hormones therapy also can inhibit. In these cases, if the patient is intolerant, cannot take oral iron, we can give it parenteral, either intramuscularly or intravenously by infusion. Intramuscularly is painful and cause discoloration at the site of injection. يعني المنطقة اللي تزرق فيها تأخذ لون تدريجيا. So you have to give it deep And remember, and you should tell the patient that it is a painful injection. But usually parenteral is used in difficult cases if the patient have got malabsorption due to a problem in the gastric secretion, celiac disease, intolerance, as I said, poor adherence, هو ما يقدر يلتزم. In that cases, or you have got very low hemoglobin, less than 6 grams per deciliter. In these cases, you give parenteral iron. We come back again to certain points that low iron could be seen in iron deficiency anemia and in anemia of chronic diseases. How we differentiate between them? By soluble transferrin receptor assay. We can check for soluble transferrin in the serum. If it is normal, it is anemia of a chronic disease. If it is high, it means it is iron deficiency anemia. And the same thing apply for a transferrin. A transferrin is also increased in iron deficiency anemia, while it is normal in anemia of chronic disease. A transferrin saturation in both conditions are low. In both conditions, anemia of chronic diseases and in iron deficiency anemia. Total iron binding capacity, it is increased in iron deficiency while it is normal or may be reduced in anemia of chronic diseases. Ferritin in iron deficiency anemia decreased, while in anemia of chronic diseases is increased. Why? Because it is an acute phase protein. Iron in both conditions will be decreased. If you see the full blood count and you find that the anemia is hypochromic macrocytic, you have to exclude other diseases, as your colleague said, thalassemia, for example, or sideroblastic anemia, especially thalassemia. These are the most important points, and the table which I have shown you is very important. So just to summarize, we have to do different examinations, different tests: serum ferritin, serum iron, transferrin saturation. حكينا الترانسفيرين saturation شو هو؟ serum iron divided by the total iron binding capacity, and also soluble serum transferrin receptor. The most common causes of iron deficiency anemia, we mentioned it. You have to remember that serum ferritin is acute phase protein. It indicates the iron store in the body. And we have put differential for the hypochromic macrocytic anemia. And also we have spoken about iron deficiency anemia therapy, oral and parenteral, and follow-up. And this is the transferrin receptor is binding to transferrin, and each transferrin molecule to 2 irons. That is to say, each transferrin receptor binds 4 irons molecules. Now, in iron deficiency anemia, we said iron is low, L low, ferritin is low, transferrin is high, transferrin saturation is high, transferrin saturation is low, transferrin receptor is high, and total iron binding capacity is high. لأنه فارغ الجسم من الايرون، أكيد التوتال iron binding capacity راح تزيد. In acute, in anemia of chronic diseases, iron low, ferritin high, transferrin normal, transferrin receptor is normal, transferrin saturation is low, total iron binding capacity could be normal, could be low. L, it means low, H, it means high, N, it means normal. I think by this, I completed the iron deficiency anemia small group discussion. If you have any question. Any question?
دكتور
نعم. بس صوتك شوية.
The spoon nails is a sign of IDA.
نعم.
Is spoon nails a sign of IDA?
Time of IDA.
لا دكتور، السبون نيلز الأظافر المقعرة ممكن تكون إشارة لنقص الحديد؟
أنت بتحكي على المورفولوجي. أنت بتحكي على المورفولوجي. كل ما زاد البيلنس at the center of the RBC، هي أخذتوها بالباثولوجي بالهيماتولوجي، كل ما صار increase in the paleness اللي سميتيها أنت مقعرة، كل ما زاد in the paleness at the center of the RBC, it means that there is less iron in the
دكتور هي
RBC.
قصدها السبوت نيلز.
ثواني حبيبي. There are also other manifestations poikilocytosis, anisocytosis, اختلاف بالشكل والحجم للار بي سي ايضا are indication of iron deficiency anemia. هذا cell morphology حكينا عليه. نعم واضح؟
دكتور هي قصدها عن النيل السبوت نيلز.
نعم
هي قصدها عن السبوت نيلز، هل هي بتكون اشاره على الايرون ديفشنسي انيميا؟
النيلز يعني في clinical exam about the nails. انت لو every one of you look at his nail, you will see them have got red, pink color. In case of iron deficiency anemia, they will be pale, whitish pale, okay? And if you press your nails with your thumb, okay, it will become a bit pale, but if you remove your thumb from the nail, the blood will return rapidly to it. This does not happen in iron deficiency anemia. It means that the iron is low in the blood. Clear? Sometimes you can look at the conjunctiva, just take down the eyelid, the lower eyelid, take it down and look at the conjunctiva. You will see your conjunctiva or the conjunctiva of your colleague. You will see it red in color, almost red, dark pink. But if you look at the conjunctiva of a patient with iron deficiency anemia, will find it pale. This means that there is substantial reduction in the iron level in the body. And there are other manifestations. You will have it in your clinical. But today we are making mixture between the basic sciences and the clinical manifestation. You are a doctor. These things will be of interest to you. Any other question? If not, I hope to you all the best, the success in your systems in the final examination. وإن شاء الله نشوفكم السنة القادمة في سنة ثالثة إن شاء الله، متمنيا لكم النجاح والتوفيق. السلام عليكم.
يعطيك العافية دكتور.
الله يعافيك.
يعطيك العافية دكتور.
يا هلا يا هلا، الله محييكم.